Good morning. I'm Dr. N. Ramakrishnan. I'm the Director of Critical Care Services at Apollo Hospitals and also a Senior Consultant in Critical Care and Sleep Medicine. The World Health Organization has been increasingly focusing on non-communicable diseases. When we say non-communicable diseases, we often think about obesity, high blood pressure, diabetes, heart disease, and cancer. But what we often forget is that sleep disorders are also a common non-communicable disease, in fact more common than several of what I listed, and can also lead to some of these non-communicable diseases. Now the world is kind of greatly worried about a communicable disease, which is the COVID-19 pandemic, the coronavirus, that has really caused a lot of concerns across the world. At this time, a lot of people are also encountering sleep problems, and I just wanted to mention about what kind of problems they could have and how simple measures could actually help you prevent some of these sleep problems and take care of your wellness. Now, when the mind is not calm, the body may not rest well and you may not have good sleep. And that is extremely common when we are preoccupied with any concerns. And today, with the fear of the disease itself, the coronavirus, the fear of uncertainties, cancellation of travel, concerns about near and dear who are far away from us, several such worries seem to be increasing the sleep problems amongst the public. Not uncommonly though, because it is certainly a worry that people have. So it is important to take care of yourself and prevent sleep problems. Now, what are the simple things one can do? Number one, in general, when there is inactivity, when you are not active, you may not sleep well. And this is increasingly possible when there is either a quarantine, if you are required to do that, or just because of the various shutdowns, you may be either working from home, or you could be isolating yourself for whatever purposes. You may face trouble sleeping because of the inactivity. So what can you do to improve activity while at home? Number one, doing simple stretches at home, doing yoga, walking either inside the house, or even better if you have an open terrace where you will also get sunlight, which is actually good for sleep. It would be a good idea to do some routine activity rather than just sitting and being inactive. Number two, for people who are working from home, while people think it is easy and enjoyable to work from home, it can actually be very difficult, particularly when you also have other people at home. So having a fixed schedule to work, just like how you would if you were going out, and more importantly, having an appropriate workspace, not being surrounded by people and concentrating on your work if you are working from home would be important. So having fixed hours to work and following that, having appropriate wellness exercises, which I was just mentioning to you, and also eating on time, having your breakfast at the right time, lunch at the right time is extremely important. And more importantly, having dinner at least about 1.5 to 2 hours before bedtime is certainly a good practice to do. Consuming milk, banana, honey are all general things that we have always advised for good sleep. So if you don't have any other reasons, not to have any of these. More importantly, we need to engage in activities that could provide relaxation. Number one, if you can't meet family who are nearby, it would be a good idea to have video conversations with them so that one, you get a sense of a connection, and more importantly, also ensuring their safety would keep your mind calm. If you are able to have a few family members at home, and once again it is highly recommended that you avoid large crowds, but if you have few family members at home, engaging in relaxing activities, it could be the good old board games that people used to play, or like watching television together, reading books when you can. So any of these relaxing activities would help promoting sleep. Lastly, but very, very importantly, people who already have sleep problems may experience worsening of sleep at this time and may need adjustment of medications. So it is important that you don't ignore this. Contact your doctor early, and at this difficult time, several doctors are offering consultations through telephone or other modes of teleconsultations. So please make use of that opportunity if medications need to be adjusted, not only for your sleep disorders, but for any other medical problem that you may have. It is important for you not to ignore your chronic medical conditions at this time. Stay safe, stay relaxed, ensure that you have continued activity. All of this would help you sleep better. Thank you. Have a good night's sleep.